Hi friends, now today I have the honor of introducing to you Dr. Vaibhav Aggarwal. He is Rank-2 JIPMER December 2019 this year, which is an awesome rank. JIPMER is the one of the most sought after central institutes to do your post graduation.
Thank you.
Vaibhav, we are really proud of your achievement. How are you feeling today?
So I'm so thankful to you and the entire DAMS family for giving me such a great support for continuing my for studying and cracking these competitive exams. I'm so happy, sir. Thank you so much.
Vaibhav, you joined us in your in a 3-year foundation course, and
Yes,
you
sir.
joined us in 6th semester. Then you did foundation classes with us. Then you did in final year, and then you did test and discussion in internship.
Yes, sir.
And how was your journey with us?
Sir, I joined DAMS as a foundation course student in my 6th semester, and at that time, I used to attend the weekend classes where they would cover one subject is in 2 or 3 weeks, and then I was used to make notes out of them. So I prefer to make notes, one subject in one notebook for one subject. So I have seen students making all the subject notes in just one notebook and just continue to make notes in that notebook as only. But I would say that it is good idea. It's a good idea to make notes for one subject in one notebook, so that it becomes easy to read it later on in future. So I used to attend classes in my 6th semester and used to make notes as good as I can. And then in my final year, I used to make notes for my first and the second year. So I made notes for the first and second year in my final year. And then when I had all the notes complete of all the 19 subjects at the end of my final year, it helped me in my prof exams as well. And then my internship, my basic idea was used to revise those notes again and again, so that it gets set in my memory. So that was my main idea.
So do you think that, if I, put it across, like your idea in the first 2 years was to understand the concepts, make notes.
Yes, sir.
And in the internship, it was to understand how to apply them in the test and discussion.
Yes, sir.
Do you think those classes and the notes that you made with us and the classes that you attended helped you in your MBBS prof also?
Yes, sir, definitely. Because it is said that the MBBS exams are tough, and especially in MAM 3, they are tough. And so, if you have notes, you can revise them very fast. So, suppose you have an exam next day and you need to revise medicine, it is not possible for you to go and read Harrison again. So, obviously, you will look at the notes and then you can revise it very fast. It will help you in prof exams as well and the competitive exams as well. So, it's a dual benefit. So, yes.
And how much, percentage of your success would you attribute to starting early? Like, you started early in 6th semester. Some people would start in internship. Some people would start in a drop year.
Yes, sir.
What do you think, that decision of joining DAMS in that 6th semester played in this entire achievement that you've done today?
Sir, starting early is really very important because the PG entrance exam has become a really very competitive now, and 50,000 students sit in the AIMS exam, and you need to get in top 20 or 30 to get an AIMS seat. So suppose you are planning to get an AIMS seat, then you need to start early. So by early, I would mean 6th semester, and some students join in second year as well, which is also a very good idea because you would get another year for you to revise notes and you used to add additional things in the notes. So that additional time is also important. So if I were to join DAMS now, I would prefer to join it in second year. But yeah, if you're not comfortable in second year, you can join in 6th semester as well.
One of the reasons why now students are joining us more in the second year now is because of the next in the
Yes, sir.
horizon.
Yes.
So because if the next comes, and which is within 3 years, the government is already planning it. Now the exam will happen 1 year early.
Yes, sir.
So the the dynamics remains the same, but you have to start a year early otherwise, because the exam would also happen a year early.
Yes, sir.
Yeah, that is one of the reasons why
Yes.
these things are changing.
Yes, sir. The exam will shift 1 year earlier. So obviously we need to start in second year then.
So when you were in the foundation year, there was no talk about exit exam.
Yes, sir. There was no talk about it.
Exit exam is a reality now.
Yes, sir.
It's a legal bill. So that is one of the changes that has happened in the recent past.
Yes, sir.
So one thing that I want to add here is, for the benefit of all the listeners, is that starting early gives you a head start, and it gives you the comfort that you are able to understand side by side and go ahead side by side. Otherwise, if you put it too late, you will have to rush through the course without enjoying the learning.
Yes, sir.
So that part plays a role in your concept building, and actually you have to enjoy learning, you have to enjoy medicine. That is one of the unsaid dictum, that people who enjoy what they're doing, they do better than others. That is unsaid.
And so I would like to add one point here is that it is very important to read notes along with the books. So suppose if you have read books but you did not join, you're not making notes, then that will not be a very good idea, because you'll be reading notes only at a later point of life. But suppose you are reading notes and the same time you're not understanding something, you are looking in the Harrison, or you're looking some other book, you're looking in Robbins as well. So that will develop your understanding, that will develop your concepts, and that is very important for cracking exams like AIMS, because they have become very conceptual, and even NEET has become very conceptual now. Even all the exams in the PG entrance has become conceptual. So it is very important
He has rightly, suggested a very important thing, especially for second year and third year students now who are listening to us. Whenever you are attending classes, side by side, when you are at your home, you will have the temptation to go towards MCQ resources or guide books, or some people collecting 20,000, 30,000 MCQ. My suggestion at that time will be textbooks.
Yes, sir.
Please
Definitely.
read Robbins when you are doing pathology in DAMS. Please refer to Harrison. Harrison is a big book, but suppose you have some difficult topic in the class, you understand it, then when you go and read Harrison, your layer of understanding will become double, and that window of reading textbook does not come back.
Yes, sir.
When you become an intern, then that point is already gone.
Yes, sir.
And at that time you have to apply the knowledge.
Yes, sir.
Coming to that application, Vaibhav, I want to know that how the test and discussion experience in internship was.
So test and discussion experience was great in internship, because an internship at MAMC, I did my MBBS from Maulana Azad Medical College, and the internship there is really very heavy. So you do not get the time to open books, and you do not get the time to to think about other resources. So you have to focus on one resource, and DAMS is a great resource for that. So what the schedule is like is that they will give you a schedule for 1 week, and then there will be a small test based on that subject, and therefore you will get a week to prepare for that subject. And the biggest advantage for that is that you will be able to manage your time properly, because there are 19 subjects to be read, and you have only 9 months approximately for you to complete your syllabus, for if you're applying for AIMS exam. So yes, so it will help you to finish your first reading very early, and that will help you to to manage multiple revisions. So yes, it was a great idea to join TND.
And I like to utilize this opportunity to add a line, because what he's saying is like how you should go about success. What he has done is the correct method. That his idea was, when he came into internship, he knew that he has made the notes, he have done the basic understanding. He also knew internship in his college is heavy. So at this time he wanted more to go towards MCQ practice. So he chose test and discussion, and he tried to manage the schedule as per the TND schedule, so that you have those landmarks coming up to finish the syllabus. Otherwise, in internship, if you drag two subjects too long, you will actually destroy the entire system. It is like time is the essence of the game. So
Yes,
that
sir.
is where the external schedule of TND helps you. And Vaibhav, I also want to know that how many times were you able to revise before the JIPMER or before the AIMS exam happened this time?
Okay.
What was your revision cycle here?
Okay, so my first revision cycle went according to the schedule of the TND. So the TND ended by 31st August approximately. So my first revision cycle ended till 31st August. I gave a week. I gave 1 week for some leftover things, and so I started approximately by 7th September. I started my second revision, and my plan was to complete my second revision in a month, but it got extended, and I was able to complete it in 1.5 months. So my second revision was completed by 15th October approximately, and then I plan to start the third revision. And my third revision, my plan was to complete it within 15 to 20 days, but it also got extended, and was able to complete it in about by 8th or 9th November. And for there was a 1 week left before the AIMS exam, and so I utilized that weeks to again look at the previous AIMS papers and all the very important topics like the AIMS capsule on e-medicos and all those very important stuff related to AIMS. So I utilized that 1 week for those things, and then I gave the paper for AIMS. And then about 15 days after, there was a PG exam, and about 1 week after, there was a JIPMER exam. So my focus was to revise my weak areas in these 15 days and those 7 days after PGI exam. So, and all the important topics as well for PGI and JIPMER. So my focus was not to revise it again, all the syllabus, but the important topics and my weak areas.
Did you utilize the previous papers to identify those important areas in PGI and JIPMER?
Yes, sir, it is very important to look at the previous papers and to look what important topics they have been asking, because they do repeat topics, and if they repeated the topic and you could not answer the question, it will harm your rank badly, because it is such a competitive exam and all other people are doing it right, and if you do it wrong, you are out of the game. So yes, it is very important to look at the previous papers.
And so, if I may ask you again, like, what was your last week strategy before the JIPMER exam?
So my last week's strategy was to look at all the previous year papers which have come in the JIPMER exam, and to look at the what topics they have been asking, and to plan the strategy as well, how to give the paper, how many questions to attempt and how many not to attempt, what questions to leave and what not to leave. So my strategy went, because I had a week after PGI, so I could do this much as well only.
And any particular topics when you were giving the exam, you've analyzed the previous papers, you've given this exam, you've actually nearly topped this exam with a rank 2.
Thank you.
So any particular topics that you feel were good, well represented in JIPMER, or you feel like somebody who's appearing for May JIPMER should not miss on? Any particular topics or
Sir, I would say that all subjects are important, and especially for JIPMER, they would ask, they would cover almost everything written in the notes. So notes are very important. Please read notes very, very carefully and mindfully as well. So please read them, and it's a very good idea to revise all 90 subjects notes in the last 15 to 20 days if you're planning for May JIPMER, because they do ask facts, and these facts can be answered only when you read notes thoroughly.
And what was the attempt ratio? In many times people tell us that when they appear for JIPMER exam, it has a lot of bouncers. How many were you able to attempt in this exam?
Sir, I saw some videos on eMedicos and YouTube, and so I was prepared. I knew that the JIPMER exam will be tough, and so leaving 15 to 20 questions would not be a big deal, because paper is tough, so you can leave these many questions. But when I was giving the paper, I realized that the paper was easy compared to May JIPMER, and so I attempted 241 questions out of 250. And so I think my attempt rate was okay, because the paper was easy compared to May 19 aims. May 19 JIPMER, sorry.
There is actually what he has suggested here is very, very important. Like, I have seen many times the people will tell you in JIPMER you should do 225, 230, but I believe that should not prejudice you when you are giving the exam, and that is exactly what he did, and that is why he's sitting with a rank 2 here. He saw the paper, he felt it was more doable.
Yes, sir.
Then what people and the previous papers had predicted, the paper was more doable. He in the exam, I think subconsciously itself, he changed his strategy.
Yes, sir.
And he attempted 241.
Yes, sir.
So it is very important, and the reverse is also true. Suppose you think that you have to attempt 241, but you go to the exam and you realize that it's a very tough paper, all bouncers. Then you have to go defensive.
Yes, sir.
So you can plan up to a point, but after that there has to be some judgments to be taken based on the exam.
Yes, sir.
Same thing I felt with this year's PGI exam also. It was a very doable PGI exam
Yes,
this
sir.
time.
Yes, sir.
So somebody is very prejudiced, might end up being over defensive and lose the rank.
Yes, sir. Actually, the thing that you're saying, the exactly same thing happened to me in PGI. I attempted very less, and I think that was the reason that I did not get very good rank in PGI. So yes, I was very defensive in PGI exam, and I think I lagged behind.
What was your rank in PGI?
My rank was 171 unreserved in PGI.
So when you had a 171 rank in PGI, and in between that week,
yes,
like
sir,
there was 1 week between PGI and JIPMER.
Yes, sir.
You would have those zones of lack of belief and lack of self motivation, and how, because you feel that am I good enough to break that barrier of top 10? How did you manage that time?
Sir, actually there have been many stressful days during the entire internship, but yes, the last few months have been really very stressful, because my AIMS performance, I was not happy with my AIMS performance as well, and my PGI performance also was not very good, so I was not very happy with my performances. So it was a stressful area, but then but because my mom and dad, they are very supportive, and they have been so supportive. My elder brother has been so supportive, and therefore it's a very good support system in my family, and therefore I could the stress of the exams, I could come out of it, and I think it's a very important role of the family that in the exams as well.
I totally agree. You need some buffer.
Yes, sir.
You need some buffer, because sometimes the things will get stressful. Some exams will not go your way. Some exams would go your way,
Yes,
it
sir.
happens.
Yes,
But
sir.
there are important things to understand, because we can learn it from him, and I think it's a very important learning for future aspirants also, that please do not be prejudiced that this is what I am going to attempt in the exam. You have to see the exam and then play according to the, like they say in cricket, like you have to play each ball to its own merit.
Yes, sir.
You should not be prejudiced that this is such a great bowler and he will give a great ball. It's not like this. And similarly in JIPMER also and PGI also, I felt this time the papers were doable.
Yes,
There
sir.
was like very few bouncers in JIPMER.
Yes, sir. A
Yeah.
few radiology questions had some bouncers, but
Yeah.
otherwise the paper was very doable,
Yeah.
and it's comparatively very easy compared to May 19 JIPMER. I would say it was a comparatively very easy paper.
But that is expected out of JIPMER. You cannot
They
have
are
a JIPMER exam
unpredictable.
without
Yes, sir.
any bouncers. Yes. And may I ask you, what did you see your score also? Like, what was your score in the end when you
My score in JIPMER was 648 out of
648?
1000 marks.
648.
Yes.
And classically, if you if we see in AIMS or if we see in NEET, people tend to score more.
Yes, sir.
JIPMER is always on that lower scoring thing, but the toppers also score low, so that you get an idea. I think if you're a future aspirant, you are a little panicking by looking at the kind of questions, but at least you get an idea that okay, even the toppers would not have done those bouncers. It is about the other doable questions that make your rank in JIPMER.
It is very important to understand that there are some questions which are to be left, which you cannot attempt because nobody knows them. So you should not indulge in those questions. Should not waste your time in those questions, because it's just going to harm your rank.
Were you happy with the resources available to you on the eMedicos app, where you had the previous papers, the new pattern DQB, you had AIMS capsule, emergency medicine with you, infectious diseases? Were you happy with those
So
resources?
eMedicos is a great application, and almost all the videos there are very useful to be watched. So I looked at the AIMS capsule, and it was a great idea to look at before AIMS exam and before JIPMER and PG exams as well, because it covered almost all the important topics. And then there was emergency medicine capsule, which was a great revision for all the emergencies and all the tricky questions that can be asked from emergency medicine, and especially for the AIMS exam, which focuses on emergency medicine very specifically. And all the other videos and the weekly MCQ series that eMedicos runs is also a very good initiative, and I liked it very much. And the AIMS new pattern questions, which you will not find anywhere else, the DAMS question bank provides those questions, and so I practiced those questions before 1 week before the AIMS exam. So it was a very good idea, because it increased my speed in solving new questions, and speed matters a lot in the AIMS exam, because of the pattern the paper has become lengthy. So it was a very good idea, I think, to solve new pattern questions.
And how long did you take to finish the JIPMER paper this time? Like, were you able to finish it on time, or did you find it challenging?
Sir, I completed my paper in 140 minutes, and then I utilized those remaining 40 minutes to look at what questions I bookmarked. I marked for reviewed, and what questions to be left. So yes.
During this journey with DAMS, were you happy with the doubt solving mechanism that we have, where the teachers interact on the Facebook club and they keep discussing every time? Were you happy with that?
Sir, DAMS exclusive club on Facebook is a great initiative, because almost any doubt that you can think of will already been answered by some faculty of DAMS. So when I was solving previous year AIMS papers, I was confused in some of the questions, why the answer of this question is this and not some other option. So when I used to look at in the DAMS exclusive club, I found almost all the answers, all the doubts that I had in DAMS exclusive club. So it's a great application. I mean, just by looking at the post of students, you will learn so much. I would not recommend you to spend much time on Facebook, but whatever time you spend, you can actually utilize it to full potential. And yes, and one advice I would like to give is that you can make another Facebook account for the DAMS exclusive club, because what I've seen is that when you join your original Facebook account with the DAMS exclusive club, there are many other posts that will come along the way, and then you will not be focused. So what I did was that I made another account from another email ID and join DAMS club, so that only the group post will come, and there's no scope for any other post, and I had no friends in that account. So yes, so I was more focused in that way.
And I think that focus, that you have to get away from the distractions to get such a top rank,
Yes,
because
sir.
if you are distracted, you will invest your time in other places. You don't have that kind of time in the internship year, and to win the game, you need to put all your time onto the task at hand.
Yes, sir.
So I think he's done very well with this entire year. He has put in a lot of hard work, and that entire hard work is showing as a rank 2 today, which is just like topping the JIPMER exam. It is so good.
Thank you,
We're
sir.
really, really proud of your
Thank you, sir.
achievement. And I also want to know from you, like, did you utilize that revision program that we do called as DVT?
Yes, sir. DVT was amazing. It was amazing because in 3 days, was able to revise all the 19 subjects, and it's amazing in all the important topics. And the interesting part is that that the topics and the images that we saw in DVT came directly in the exam. In AIMS exam also, in JIPMER also it helped, and in PGI also it helped. So it's an amazing thing, and the revision, and there were very short videos on e-medicals that they put in after DVT, and those 30 to 20-minute videos, and you can see them in half a day, all the 19 subjects, and they will be most high-yielding stuff you can ever imagine on planet, I can say. So it's a very good idea to attend DVT and then to revise it also, because no, it would be a mistake if you attended DVT but you could not revise it, because you will forget many images and very important points that faculties asked you to note, and you could not focus on that at that point of time. So it is important to look at DVT again, which the mistake which I did before the AIMS exam, because I looked at only very important only the videos which I thought that I need to see again. But I could have, if I could have watched all the videos again, then I would have scored better in AIMS. So I think it was a very important idea to revise all the videos.
Were you happy with the format in which we provided the DVT images? We actually made a paradigm shift by including teachers describing the videos and all that. What was that experience all about?
So actually, when I see the group posts on Facebook, many students were angry by the fact that they did not give the images and they were providing the videos. But I think it was a very great idea to actually to look at the videos and not the images, because you can look at the videos very fast. You can increase the speed at 2x, and then you can watch it again, and then it will stick to your memory if somebody is speaking to it. And if you are looking at the images, you'll be a passive learner, and then the important points will be missed. And the whole idea of DVT is to stick those important points in your mind. So I think it was a good idea, and I think one should look at the videos in a very positive way. In fact, all the grand test videos also are really very important, and one should look at them also. People skip those videos and they just look at the solutions, but I would prefer that you should look at the videos, because and you can increase the speed to 2x, and then you can watch them.
And I would like to add here is that why people would want that print out or those slides, because in our mind sometimes we want to collect things, but the problem is that even if I give you that collected material, but somebody has to make it easy for you to take it out, and that is where DAMS comes in. I want to make it easy that I am giving you the entire material in 10 minutes. Listen to us for 10 minutes, it will be done. So that is where the entire thought process, and I'm very happy that most of the rankers who we have met this time, and they've in the AIMS, after PJ, after JIPMER, they've all appreciated that video based revision of DVT. I also want your comment on the CBT exams that we have taken, and what were your ranks in those exams?
So I gave CBT 2 and CBT 3. In CBT 2 I got a rank of 4, and CBT 3 I got a rank of 27.
Okay.
So these are the two CBTs.
And later on you got the AIMS rank 27 and PJ rank 2. So those ranks, the JIPMER rank 2. So
Yes.
they kind of correlated with your real ranks.
Yes, sir, really, yeah.
What was the experience during the CBT? Were you happy with the simulation of the exam, and did that give you confidence that you could do well if you could do in DAMS CBT a rank of top rank, so you could do in the real exam also?
So giving computer based test is important, although the exam will be like a GT, but it's very important to give it in a computer center, because the feel of the exam is important, and the anxiety level which will come in the real exam will decrease, and so it will improve your speed as well in the real exam, and the confidence will also be it's an important thing in the real exam, so that improves your confidence as well when you're performing in a computer based exam, and you know that all the people around you are competitive, and the number of students will also be actually the same in CBT and the AIMS exam and the JIPMER and PJ exam. So the competition also will matter, and the feel of the exam will matter. So it is important to give CBTs. Yes.
And any advice that you want to give to future aspirants, or any motivation message or any message for them?
Yes, sir. There are two very important messages that I want to give. First, that focus on standard textbooks in your MBBS. Please, it is very important to attend classes, make notes, and very good notes. But it is not important to practice MCQs at this point of time. It is important to read standard textbooks because this is the only time you'll be able to read it. Internship, nobody gets to read it, and even if you are repeating after internship, you will not be able to read it because it will not be a fun in reading textbooks again.
Yes.
It is fun only when you're doing MBBS,
Yeah.
and
And
so
plus, that helps you in the prof also. It is going in that synchrony kind of thing.
yes, sir.
And I want to add here, even if you don't do well in NEET, the results will come 1 month later. And then, if you get a borderline rank, there is some counseling happening and all that. So many people think that when they are dropping, they will get more time. But actually, it is not the truth.
Yes, sir.
You are absorbed all the time. Should I take a compromise subject or not? And all that takes 3-4 months in between. So reading good quality books at right time is a correct message. It's a top message by Dr. Vaibhav Aggarwal. I think it has a lot of value in it.
And sir, one advice I would like to give during my MBBS time is that if suppose you are reading Robbins and suppose you find something very important, what you can do is to take a screenshot of that photograph or of that excerpt from that book, from any other book. If it's like from Bailey also, you can do that in other books as well. And you can if it is a very important stuff, because you cannot write everything in your notes, it has to be very high yielding. So it's a race between increasing the volume of the notes and also making it very high yield at the same time. So if you think it is important but you cannot write it, and obviously images you cannot draw it in your notes, then you can take the screenshots, or you can use OneNote, or you can use Google Drive. I used Google Drive. So you can collect all those important screenshots, and you can then revise it again in internship. So that will be a revision of Robbins. So suppose you have taken screenshots from Robbins, from all the chapters, all the important images and excerpts, then you can revise it Robbins in say in a matter of 3 or 4 days. So that's a very good idea. And the second advice that I wanted to give is that it's very important to attend internship, because the skills that you develop in internship will help you in long run, first, and second, it will also help you in competitive exams, especially the AIMS exam in November 19. This exam was very practically oriented, and they asked about intubation, they asked about suturing, they've always been asking this, they asked about ABG analysis, and those are the stuff that you do in internship. And if you have done your internship well, it will help you. It will definitely help you in the exam, and all the rankers who have got good ranks have attended internship, and it's a good idea to attend internship. You should not escape from it. So this is the second advice I wanted to give.
Excellent advices. And I think, I'll add a line here is that what he said about taking snapshots is a very good idea. I've seen many rankers do this over the years. What they do is that, suppose in a textbook or even on a DAMS club, sometimes the teacher will post up a picture and you feel that I want to see it again. What toppers are doing is they take a snapshot on the phone, and in their phone they arrange it in folders.
Yes,
you
sir.
can use some application for it, OneNote or Google Drive, or you can create simple folders where you have a folder of anatomy snapshots.
Yes, sir.
Now what happens is that you are on a bus or on a metro, you don't feel like studying, but you can flick through the images, and that also is a part of revision. It's a very good strategy. You can't write everything down sometimes, so it's a good idea, because to write you have to be in a classroom, and that scenario you are able to write more. At your home, sometimes you cannot do that writing too much, so you have those snapshots. It's a very good idea. I've seen a lot of rankers utilize that.
And so it will help you in one more way, is that you can consolidate things. So suppose you are looking at a Facebook update, and at the same time you are looking at the image in e-medicos, and the same time you got image from Robbins. So you have to consolidate, because you cannot open Robbins and then e-medicos also and then Facebook club also, because it will waste your time. So in the last 1 month you need one resource, and that will be a notes. But at the same time you should have an additional resource of images. So only 2 resources would be enough, but would be the only thing that you need to do in the last 1 month.
Yeah.
So,
And another thing that I would like to add here is that what he has talked about internship is very important as well. But I like to add a line here, especially for second year students who are listening to us today, that people who are in second year today or third year, one of those batches would be the first batch to appear for next. So you cannot postpone understanding to internship. You have to accelerate it a little bit now, because next would happen at the end of final year.
yes, sir.
So some things, some skills these children had the time to learn in internship, but you have to accelerate the matter. That is where I believe that second year is the correct time now to join. They joined in third year because that was the norm at that era. In the today's era, second year is the norm. Don't postpone it. Don't get into the procrastination idea, because when the exams come, people, or when the change comes, people tend to believe that it will not come for my batch, but some one batch will be hit in within 3 years, and usually with this government, sometimes it comes earlier than you expect. So it's a good idea to start thinking of this early. You may not get the internship advantage to learn the clinical skills. You have to accelerate the learning initially itself. And that is where understanding sitting in the classes helps. And that is where we have taken this initiative this year, that now we have added practical courses also on the app. There are a lot of patient encounters that we have recorded on the app, just to give you a feel of how the actual thing feels like.
I was thinking of looking at these surgical practical videos as well,
Yeah.
but there was no time, so I could not.
But there were questions on that
Yes.
in surgery.
Yes, there was a question on examination of thyroid.
Yeah,
So,
yeah. Any particular teachers that come to your mind?
sir,
Today?
all the DAMS faculties have been amazing, and I would not like to mention any particular teacher because I don't think that would be a justice, because all the DAMS faculties are so motivated in teaching their students to solving doubts, and it was a pleasure studying at DAMS, because you get to know the subject, but at the same time you get to know the you feel the motivation the teachers have for the students, and that itself motivates you to perform well. And but I would like to specifically mention Dr. Avin sir. He's an amazing person. And his medicine concepts are out of the blue, and so it's a pleasure to listen to him, to listen to his videos. And I made it a point that I looked at almost all the videos that Dr. Avin has posted anywhere, be it eMedicos, be it Facebook Club, be it in the class. And yes, so I am a big fan of him.
And recently, Arvind took this initiative and he's put some clinical videos on YouTube. I don't know if you saw them or
And
not.
I could not
About,
see them because no time. But
you have already topped the exam. But now he's come up with those, how to do the percussion, how to examine, and all those ascites, how to look for them clinically. We have added that dimension of that clinical encounters now, which we have evolved over the years. Now, Vaibhav, I also now want to know, which branch are you looking forward to take?
I'm actually confused because I got a rank of 2 in JIPMER and I got a rank of 27 in AIMS November. So I'm confused between general surgery at AIMS or baby medicine in JIPMER. So I have to decide it now. I have to think about it.
Let's hope and let's wish that you get the branch of your choice in place of your choice, and you have a great medical career ahead. And we're really proud of your achievement. We have with us Dr. Vaibhav Aggarwal, rank 2 JIPMER. He has nearly topped this exam. He has had a little bit fluctuant November, December. He had a 27 rank in AIMS, then went on to have 171 in PGI. Still hung on, gave one more week, and always stuck to his belief that he is good enough, and he got a rank 2 in JIPMER
I
exam.
would like to, sorry to interrupt, but I would like to mention my mom and dad and my elder brother,
Totally.
because they have been very supportive, and it was not possible without them. And I think the role that they played is more than what I played in my performance, and I would be eternally grateful to all of them. I cannot thank them enough. And then I would also like to mention the faculties at MAMC and all my friends, and I would like to especially mention 2 of my friends, Vishal and Vineet, and our group of 3 people. We have been so amazing, and we always used to discuss stuff other than studies as well. We used to joke with each other so that it decreases our stress especially during internship, because internship is stressful. So we always used to make fun. Even now we used to make fun. Whatever time we get, we make fun of each other, and I think that is very good idea to have a good friend circle around you, a good family support around you. And suppose if you are living in hostel, then it's a very good idea to surround yourself with good people, because if somebody else, your friend, is getting a good rank, then you will also get it.
And surrounding yourself with positive friends and family support, I think all that matters. Being a Molanian, I understand when you say pull each other like legs, and I understand what that means. In Molana Azad Medical College, we have that tradition of we have that smaller groups where you have very closely bonded. Like I'm
sir.
till today I have my 2 friends, and we go-to friends where and we will all the time joke about each other, but we are the support to each other also. I think I'm really happy to know your journey. It's a pleasure to interact with you today, and I feel that you've done a great job. And I feel that there is a point that everybody should notice, that when you have multiple exams, there could be an exam that does not go your way, but you have to stay on. What do you say to that?
Yes, sir, I definitely agree with you because this happened with me and this has happened with many other people. So it is important to stick because you will get a rank in one of the exams because there are 4 exams now. So you will get exam if you're prepared well and if you're motivated enough, then you will definitely get a rank in one of the exams. So and you need one rank only to get an admission. So yes. And sir, I would like to mention few lines which you spoke about 1.5 or 2 years back. I don't remember where, but you said that I'm quoting. मुझे घबराहट इस बात की नहीं है कि मैं किसी चीज़ का सपना देखूं और उसे पूरा ना कर सकूं. मुझे घबराहट इस बात की है कि जिस चीज़ को पूरी करने की मैं काबिलियत रखता हूं उसका सपना ही ना देख सकूं. तो इट इज़ वेरी इंपॉर्टेंट टू ड्रीम बिग because even if you dream big, you will be able to achieve it. Only if you think about aims, only if you think about PGI, only if you think about JIPMER, you will be able to get it.
Thank you so much, and I remember that line. I still totally agree with it कि मुझे इसका डर नहीं कि मैं जो सोचा वो कर ना पाऊँ. कहीं ऐसा ना हो जो मेरे में क्षमता है मैं सोच ही ना पाऊँ या सपना ही ना देख पाऊँ. And he is a great boy. He always had the capabilities to get into central institutes. Now he is sitting with a top rank in JIPMER exam this year. It is a great achievement.
Thank you, sir.
I'm
Thank you so
sure,
much.
and I want you to take a good decision out of it.
Yes, sir.
I want you to understand your opportunities. I want you to understand what you are getting, and I want to take this opportunity to congratulate your parents.
Thank you so much, sir.
I'm sure they would be very proud of you today.
Thank you so much.
We are all at the entire DAMS team is very proud of you. Heartiest congratulations.
Thank you, sir. Thank you so much.
God bless.